test was positive.
Just one shot, the doctor cured a mute man. At the wedding, the man suddenly lost his voice. Then, the man clutched his neck in pain and fainted. At the hospital, the doctors checked him out, but everything seemed normal. So, Dr. House picked up the syringe and jabbed the man. The man screamed in pain, but what happened next was even stranger. The man suddenly found that he could speak again. House immediately called him out, saying he was just faking it because he didn't want to get married. But the woman didn't buy it. She had just seen the man pass out in pain. To prove his point, House pretended to collapse in exactly the same way the man had. That finally convinced the woman. After they left the hospital, the man insisted that he really couldn't speak earlier, but the woman still wasn't sure. Then, the man suddenly started coughing violently and had trouble breathing. After running some tests, the doctors found out the man had severe fluid buildup in his chest. They suspected he might have ingested something toxic, so they went to his house to look for clues. That's when they found a man claiming to be his boyfriend. Turned out, the man was gay. But if he was gay, why was he marrying a woman? The man explained that he used to be gay, but after undergoing therapy and electroshock treatments, his sexual orientation was supposedly fixed. House thought the electroshock therapy might have caused some brain damage, but when they did an EEG, everything looked fine. Then, the man's beta waves spiked, and he rolled his eyes, signs of a heart attack. The doctors worked hard to save him, but when he woke up, something even stranger happened. As soon as the man sat up, he collapsed again. A moment later, he woke up, but when he tried to sit up again, he fainted. House figured it was positional tachycardia syndrome. His blood pressure dropped when he stood up, but it returned to normal when he lay down. The doctors kept checking him out. They noticed his chest was wet and thought he was just sweating. But when they lifted his shirt, they were shocked because the man was actually lactating. The doctors checked his prolactin levels and scanned his pituitary gland, but everything came back normal. So why was this guy lactating? That's when Dr. Wilson said something that made House have an epiphany. House went into the man's room, gently lifted his head, and, miraculously, the man's headache completely disappeared. When House let go, the pain came back. But as long as he kept holding the man's head, the pain would stop instantly. That's when House finally figured it out. The man had Chiari malformation. His skull was abnormally narrow, which messed with the circulation of cerebrospinal fluid. The electroshock therapy had caused his brain to swell, blocking the already narrow skull and even pressing on his pituitary gland, which explained the lactation. With surgery, the man could be cured and get back to normal.